Bismillahirrahmanirrahim. Sa'id bhai, this is Rehan. Once again, thank you very much for your last visit. I think it's very important that I follow up with you with more pertinent information on what we talked about pharmacogenomics. I have here with me my partner, and he's Dr. Adnan Mazri. He is a PhD in genetics. He's also medical director for our lab, and I would leave his introduction to him and to shed some benefits and light on the importance of pharmacogenomics. Adnan, brother Sa'id, we're gonna have this video. You can please go on.
Thank you, brother Rehan. I appreciate it. It is my pleasure to talk today about pharmacogenomics and how this discipline can affect really all of us. So, my background, I have a PhD in molecular genetics, and I've been involved in pharmacogenomics probably since its inception, a little bit less than 10, 12 years ago. So it is a fairly new science, a fairly new discipline, but it's spreading quick and wide in the United States and other parts of the world. Pharmacogenomics is essentially how your genes respond to the medicines that are given to you. We are all similar, yet very different. We all have the same genes, but we have different traits. We have different hair color, different eye color, and many other different traits. So similarly, also these genes dictate not only those traits, but they also dictate how our enzymes inside our body break down these medicines that are given to us. And in that sense, we are all very individual and very different from each other. The concept generally is one pill fits all. So your doctor will usually give one medicine for one ailment, and maybe ask if you are over a certain age to take half a pill or a full pill. But generally speaking, you will get the same medicine as everybody else in the world for this ailment. However, we're all very different. With time, in the last 10 years or so, we've been finding out that we have different genetic makeup, which alters how we respond to this one pill. You see people that benefit from medicine and people who don't. And the reason is because we have such a variation in our genetics. So what I wanted also to highlight here is that the specific traits that make us so different can cause these medicines to be have side effects. You hear about medicines have side effects. Why is that? Why do some people have side effects, others don't? It's because of our genes. Why do some people have adverse effects, even to a point where some people, there's documented cases of death due to different genetics and a medicine? It's because of our genes. And why some people have no response at all to the same drug that somebody else is taking? Because our genes react differently and metabolize these medicines differently and break them down differently. So for that, pharmacogenomics is a test that is done in the laboratory. It is becoming more and more like a laboratory companion test that physicians use prior to prescribing medicine, and to give them help with what specific medicines to prescribe for that person based on their genetic makeup. So for instance, a good example is Plavix, which is clopidogrel. It is a medicine excuse me, given for heart patients to prevent strokes and heart attacks. That medicine is metabolized based on your genome. If you have the normal, and I say normal, meaning the majority of the population, 60-70% genes, you will benefit from this medicine. But the other 20, 30 or so percent benefit not at all. And they are under the false assumption. So now you're giving an expensive medicine to a large member of the population, and they have no effect. Actually, they believe they are being protected by this medicine, whereas they are not. So that is very dangerous in itself, and is also very expensive. If you do the math of giving this person or these people medicine they don't benefit from, and the duration of time it takes to figure out they may have side effects, then you treat with other medicines to counter these side effects, and in a sense you have no benefit from these medicines because these people have a different genetic makeup. We can determine with a simple cheek swab. So it is not an invasive test. It's very simply applied, room temperatures, very simply transported to the lab here in the US. We can test for many genes, and these genes can tell us what medicine is best for this patient before we prescribe. And we can surely do so without changing the medicine after a while. Now, there are many hundreds of examples of these medicines that are beneficial. The cost savings could be huge if you add up the population and the medicines that are being given to patients unnecessarily or wrongly. Needless to say, of all the side effects that are, come about from getting a medicine that is not specific for that person. Now, pharmacogenetics used to be very expensive. It used to be $5,000-$6,000 per patient to perform such tests. But with advancement of science in the last few years, now these tests can be a few $100s, so they can be available to the general population. It is a test you perform once in your lifetime. Your genes don't change. You will never do this test again. So this test is widely available in the United States, and we do it with confidence and report on it directly to the physician to interpret this to their patients. This test can now be available